All right, thanks very much. I really appreciate the introduction, and I'm just getting my own screen shared here. Um, it's possible to get a virtual thumbs up if this is sharing well, or maybe a hint or a shake of the head if it's not sharing well. That would be very helpful. But hopefully we'll get into the slideshow mode here, and we'll get started. I'm Michael Schwandt. I'm a medical health officer at Vancouver Coastal Health. So working with our public health program on health promotion, health protection, and prevention of illness at the community level. And I really appreciate the chance to present to everyone who's come here today. So thanks to all of those, the host organizations, and also some of our team who I've named here on this slide in our Healthy Environments program. It's a team effort that we have here. And while I am speaking with you, there's a lot of different folks who are involved with this work and helping to share this information too. Appreciate the land acknowledgement that was delivered to open this presentation. And just for my part, I wanted to know that I'm presenting myself on the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations as well. Vancouver Coastal Health operates on the territories of 14 different First Nations in southwestern BC. And I think when we're talking about topics like extreme heat, wildfire, smoke, and impacts of climate change, really important to keep in mind the role of colonialism, systemic racism, and both the causes of climate change and the disproportionate impacts of these processes, and really carry a commitment to reconciliation forward in that work. So again, thanks for the acknowledgement that opened this presentation. In terms of the outline, we'll talk a little bit about just the predictions for heat and wildfire smoke events, things that we expect to see over the years and even this summer, some of the potential health impacts of those events. A little bit about the specifics of who might be more at risk for some of these conditions and health impacts, and finally, how we can plan and take action to help to protect the health of our communities. So extreme heat, and this is pulled from the City of Vancouver's recent update to their climate change adaptation strategy. I know that not everybody calling in is within the City of Vancouver, but it's just kind of a representative picture, certainly from this corner of the province, the health region where I am. There's definitely data available from other municipal and regional governments around the province. We do expect to see, these are projections looking ahead to 2050. We do expect to see warmer temperatures increasing by potentially 2 degrees, which might not sound like quite so much. A day being 20 degrees rather than 18, it's not so bad perhaps. But when we think of the fact that this prompts having 9 times as many very hot days, as we call them, or triple the amount of quite hot days at 25 degrees, these are thresholds where we begin to see health impacts. Where we know that can impact on a lot of different populations, and those are going to become more and more common. We need to stay committed to mitigating further climate change, but also aware of the impacts that we expect to see, becoming more and more resilient to that. One of those things involves the frequency and intensity of heat waves, which we expect to be more frequent, last longer, and be more severe in their nature. And likewise, air quality. We've really seen in recent years that severe wildfires in British Columbia and Alberta that could cause impacts on air quality, both near and far, have become just more frequent, to the point that we have wildfire impacts throughout the province almost every year. Now, it used to be something that we might see, might or might not see on a given year, but we really need to be prepared for that every single season. And this is something, again, we just know that we hate to see that climate change is locked in. A certain amount likely is, and we need to contend with this while we try to limit further climate change. As for this year, some of the issues, the lower amount of precipitation, both rain and snow, the smaller amount of snowpack that we have, leading to less melt and runoff, has positioned us in a situation where some wildfires did not even go out over the course of the winter. Unfortunately, some of those have been called colloquially zombie fires, and that they're likely to rise again and continue in the spring and summer. And as well as that, we expect to see just a higher risk for ignition and more severe, long-lasting wildfires within our own province. These are some of the predictions that we have from Environment Canada and BC Wildfire. Just talking about some of the health impacts that we expect to see. I know this contains a lot of information all in one place, and I'll skip down to the symptoms here because we'll talk a little bit more about the potentially susceptible populations. For extreme heat, we really do see a spectrum of potential impacts, and we try to separate those into heat exhaustion and heat stroke for reasons that I'll describe. And many of us have probably experienced symptoms of heat exhaustion at different points. These could be familiar symptoms for just being out in the heat for too long, for potentially engaging in a lot of physical activity on a hot day. So some of us might be familiar with, naturally enough, with sweating heavily, even having a bit of a headache or dizziness when we're exposed to heat for prolonged amounts of time. All of these symptoms that are listed here are signs that we should try to limit physical activity, get to a cooler place, certainly hydrate, both for ourselves and then also for those who we might be supporting. So people in organizations that we're working with, in healthcare, and certainly not-for-profit housing. These are some of the key symptoms to look for early on. Now, when we move into what we call medically neurological symptoms, so symptoms of decreased levels of consciousness, so not just feeling a bit dizzy, but actually potentially being confused, even being drowsy, less coordinated. These, naturally enough, are very concerning, and really we draw a bit of a line from the immediate advice to try to cool off to really seeking medical attention at that point, as well as cooling off. And I think that that's a common question that we receive is, when do I need to go from trying to do the best that I can within the home to actually getting out and seeking care? And those sorts of symptoms are true red flags. And these are health impacts we have seen in recent years. We opened this presentation mentioning the BC heat dome. We know the summer of 2021 tragically saw over 600 people die in this province from the health impacts of extreme heat. This is just a look from our recent climate change and health report at VCH on our emergency room data during the same period of time. We saw heat-related illness, which isn't a particularly common cause of visits to the emergency room, as you see here in these blue bars across the graph, really spiking in late June of 2021. The maximum and minimum temperature depicted there, and we should see that when we see that spike in temperature, there's a commensurate spike in emergency room visits. So that threshold of around 29 or 30 degrees, or much higher than that in the case of the heat dome, really does come with potential severe health impacts. Moving over to wildfire smoke, again, there's quite a spectrum of symptoms, and we probably all experienced these during some of the wildfire exposures that we've had within the province recently. Things like a sore throat, irritation of the eyes, runny nose, all of these symptoms of local irritation. So particulate matter getting to the mucous membranes of the eyes, nose, and throat can cause a lot of irritation, and some of the symptoms that are described there. One of the challenging aspects of wildfire smoke, though, is that it doesn't cause just local irritation, but that fine particulate matter and other aspects of that pollution can actually get deep into the airways, even cross into our circulatory systems, and cause system-wide inflammation. So this can increase the risk for, as well as things like respiratory illness, even risk for exacerbations of heart conditions. So we do see an increased risk for heart attacks, for angina and related conditions, as well as others during exposure to wildfire smoke, particularly for those who have pre-existing health conditions. So really moving from that local irritation to things like chest pain, feelings of palpitations of the heart, severe shortness of breath that doesn't go away. All of those are reasons to seek prompt medical care. And again, just relating this to some of the local data that we have, in this particular graph, we just see in these blue bars are just showing the counts for asthma-related physician visits. So people going to a family doctor, emergency room, or other contexts for a visit where the doctor noted that the diagnosis or the reason for the visit was asthma, is what's shown in these blue bars. As well as the particulate matter, so the main high-risk component of wildfire smoke is shown in the purple line across these graphs. And again, what you see is when that purple line goes up, when there's more particulate matter in the air locally, again, this is from the Metro Vancouver area, we see many more people visiting their physicians for asthma-related reasons. So those bars are colored orange for reference, and also many more refills of asthma-related prescriptions in drugstores. Again, there's a pretty clear baseline week to week. We see those weekend dips every week too. So that's kind of reflecting real life when people go to their doctors and the pharmacy. But we do see this block of people going to their doctors and filling prescriptions related to asthma when that particulate matter is in the air. So whether that's mortality and deaths to the less severe impacts of people, but still very important, people needing to seek medical care urgently and filling these prescriptions, we know that this is having an impact, again, right here locally. So getting into some of the specific risk factors, we like to separate those into what we call the biomedical causes, so things like pre-existing illnesses and that we'll talk about, but also things about our environments and our social, the social environment that surrounds us that can place us at risk for the health impacts of these conditions. We've had a lot of opportunity, unfortunately, to study these. We have a coroner's report from the heat dome, the Vancouver Coastal Health Report on health protection throughout the climate emergency, and other studies that have been done in the province. As we see more and more of these impacts, it's important to monitor and study who is affected, how they are, and most importantly, how health can be protected in those cases. So just sharing a little bit of the findings, synthesizing across those different reports. In terms of the risk at the individual level, some of the risk factors that are people at higher risk for heat-related illness are listed here. We know that older age is a major risk factor. I won't read each and every one of these, but a variety of pre-existing health conditions. Mental health in particular has been flagged as a risk factor in some studies from our BC Centre for Disease Control, potentially related to some medical associations with higher risk for higher body temperature, but also potentially related to social connection and the intersection with some of our social determinants of health. And then a variety of other conditions here, including people who are underhoused or marginally housed, who are less able to cool their own space. This is, I think, a major issue. When we look at the level of the environment, the neighborhood, we know that the temperature exposure varies a lot from city to city within our province, from region to region, even block to block within our cities. And this is City of Vancouver data gathered from literally as I understand it, the land surface temperature by a flyover on a hot day, and they found vast differences, if you look at this, in the temperatures between different areas. So you see temperatures well, over 29 into the low 30s in parts of the downtown east side, the east side of downtown, even in southeast Vancouver. Warmer temperatures common throughout the east side of the city, and then these cooler temperatures, naturally enough, in some park spaces, but also across generally swaths of the west side of the city. So really big differences, sort of, well over 5 degrees in some cases within a kilometer or two. And this relates to the vegetation, green space in the area, building materials, concrete. I think all of us have a sense of the places when we're in that this is going to be a warmer place on a very hot day, the sorts of materials that are around. And this has been well described, this urban heat island effect. And we see one kind of circumscribed in red up there in the top right of this slide, where we see much warmer temperatures than the surrounding area. So there's things that we can do in the longer range, working with city planners and our colleagues in that area to try to mitigate against that. But in the meantime, we do need to be aware that that risk can be higher in some neighborhoods than others. Then moving from the neighborhood level right to the household level, there's building level factors that seem to be very important. We've had a study working with BC CDC and the City of Vancouver to examine surveying people about the temperatures in their homes during the summer, during hot periods, and also gathering information on the nature of their homes as well. We know in BC that some of our housing is not necessarily constructed with the expectation of very high temperatures, because historically we haven't had to deal with that. And we see that being on the top floor of a building, having very large windows, which are quite common, can actually be a risk factor, naturally enough, that kind of literal greenhouse effect to warm our indoor spaces. And the direction of windows can be a risk factor as well, facing west, southwest, where the sun is shining on them all afternoon. Naturally enough, an air conditioner or heat pump is quite protective, but also neighborhood green space and the north-facing windows resulted in cooler places. So there's some pretty predictable factors about which homes were warmer and cooler throughout our summers. And this is data from the last 3 years that we've been running this particular study. And again, that maps pretty well to what we see in terms of those emergency room visits. This is, again, related to that data that I described, people coming to our ERs during the heat dome in 2021. And we see kind of a heat map of the home addresses of people who attended the ER, again, clustered very much around some neighborhoods with where that urban heat island might be experienced, as well as some other potential risk factors. And as well, I think it's important to talk about the social side of this. We know that social connection and support can be extremely protective of people who might have these risk factors for heat-related illness during a heat event. the absence of those connections, of those supports, is also a very severe risk factor. The coroner's report from the BC Heat Dome found that people who did not have social supports, who were living alone, who were socially isolated, could be at much more risk because they did not have people who were checking in on them, who are able to support them to get to a cooler space or cool their own home. And there's a lot of overlap. It won't surprise most people on this call to learn that all of these risk factors I've been describing, from the medical to the neighborhood and housing to the social, often do intersect. There's some similarities to the risk factors for wildfire smoke impacts. I won't go right through this because there's so much overlap, and I want to make sure I hand off the presentation in good time. But just note that even more so than extreme heat, infants and young children can be at quite a lot of risk for the impacts of wildfire smoke, as well as people who are pregnant. Just the biological development of the lungs is still ongoing for before and after birth, and then for many years in childhood and youth. So that's just another risk factor. So thinking of families, thinking of younger children is very important when it comes to wildfire smoke. Now, in terms of planning for this, there's a lot of advice on how to keep people cool. Some of this is, I think, some of this might feel intuitive to folks, but I wanted to go through some of the good practices: getting to a cooler space, hydrating, and using water in different ways to cool off, helping the body with its natural evaporative mechanisms, whether that's through a cooled shower, wearing a wet shirt, applying a damp towel to the skin. Anything that can help the body to evaporate heat can be very helpful. Wanted to talk a little bit about approaches to keeping spaces cool, as well as air conditioners and heat pumps. There's a lot of passive approaches to cooling spaces too. So using blinds and shades, external window shading and films that many buildings might be adding these days can be helpful. And very importantly, trying to make sure that windows are closed during the day when it's warmer outside, and taking advantage of the cooler overnight temperatures when they're there. Whenever it's cooler outside than inside, letting that cooler air in and the heat out can be very helpful. But overall, I think that AC and heat pump piece is very important. Just flagging the 26-degree temperatures is where we start to see increased risk for people who are vulnerable to extreme heat. And at 31 degrees, really an inflection point and that risk going right up. Did want to note that fans can be used to move cool air from one area to another, but should not be directed at people when temperatures are very high. They literally create a convection effect when temperatures are hotter than body temperature. So we want to be mindful of using those not as a primary cooling method, but specifically to move around cool air. Now, there's a couple of notes here that I had on cooling centers and cooling spaces, but I do want to be respectful to the following speakers. So I'm going to call it off here. Just noting that I have this information on cool spaces and a few resources that will be in the presentation. I will share the slides, so all of that's available. But rather than just going to that, I prefer to just stop right now and move to questions. I know there's a few more minutes for that. Just being mindful that I don't want to delve deeply into my colleagues' time afterwards.
Fantastic. Thank you so much for sharing that, Dr. Schwandt. I will go ahead and begin sharing for you, Dexter.
Thanks, everybody. And Dr. Schwandt just mentioned questions. I think we're doing them at the end, so just wanted everyone to know we will have some time at the end for questions as well. Thanks, Dr. Schwandt, for that presentation. Really informative and really great to hear some of that information. And good morning, everybody. My name is Dexter Charlebois-Holmes. Thanks for having me here today to present to this group. And a big thank you for everyone and your interest and participation in today's session as well. It's great to see so many people that are interested in extreme heat and just getting trying to get yourself ready for this year, as we're getting more and more aware each year of kind of the impact. It's great to see that there's lots of interest. I'm joining you today from the Operational Services branch of BC Housing. This is the branch that supports the regular operations of our nonprofit partners, and I'm here today to speak with you about some of our extreme heat response going on at BC Housing. Next slide, please. So there's been a couple of acknowledgements already, but I just wanted to also put it out there. I think Dr. Schwandt had really, really important things to say about some of the Indigenous relationships that we work with in the community. BC Housing as well, working across the province. We have hundreds of Indigenous peoples and nations that we work with across the province, and just really want to acknowledge the importance of the role of supporting these partners and other partners, but especially regarding the environment and the land around us. We want to acknowledge that the Indigenous nations have played a a significant role in the caretaking and supporting of the lands for many generations. And I'm joining you here today from the Musqueam, Squamish, and Tsleil-Waututh areas. Thank you. So for our presentation today, we're just going to do a quick intro and outline of BC Housing, just to give some background of our organization for those that might just want a little bit of a refresher or understanding of where BC Housing sits. Then we're going to speak to some of what BC Housing is currently working on in response to extreme heat and wildfire smoke. We're going to look at some changes on how our buildings are being built in the future. My partner, Pat, from our security and emergency services team is going to join to discuss some key elements of emergency response planning. And then we're going to wrap it up with some tools and resources that will be available through our website. So many of you will be familiar with this, but I just wanted to give a quick overview of BC Housing's role to help define our relationship to how we support our nonprofit partners in areas like extreme heat. So BC Housing is a Crown agency, formerly known as the BC Housing Management Commission. We fulfill directives of the Ministry of Housing and receive those directives through an annual mandate letter. We then work with municipalities and our nonprofit partners to do things like create new affordable housing, create developments that are financially and environmentally sustainable. And we also are looking at needing to include resiliency to climate change in those development plans, as well as we get further into this developing these kind of structured new buildings and making sure they are climate resilient. And we ensure consistency within our regional and community priorities. Next slide, please. And here I'm just going to share with you just a list of some of the partners and people who we serve. I'm not going to go over everyone in this list, but you can see it's a very fulsome list. We have 800 housing providers that we work with, and over 110,000 homes are interacting with BC Housing in some way. I won't read this list fully, but what I will say, most people that we support here are at some level of risk during times of extreme heat. Many tenants in community housing have characteristics that may increase the risk to adverse effects from extreme heat, as Dr. Schwandt noted. And this looks at things like health conditions and lack of access to cooling. Next slide. So BC Housing has been thinking about extreme heat for a number of years, but as we all noted, the 2021 heat dome was a real wake-up call for us, as it was for everyone else. And in response to this event, BC Housing developed an extreme heat and wildfire smoke action plan that laid out activities that we need to work on in these 5 areas. So in this action plan, we look at increasing capacity within the nonprofit housing sector, building organizational capacity within BC Housing, reducing risk of overheating in new construction and existing buildings, research and engagement, and collaborating with stakeholders. The plan was originally created in 2022, but we're continuing to provide updates to this plan. I'm actually just going to put a copy of the new plan this year that we just released in March. So I'll throw this into the chat for people that are interested. Probably have a few different links for folks that are just interested through the presentation. Feel free to look at it outside of the meeting. Oh, sorry, can you go back one slide? Sorry, Natika. So the focus of the presentation today is on immediate preparedness, but we also want to mention some of the work that BC Housing is underway on medium and long-term solutions. So this looks at more of including changes to the way that we're building buildings. So we've recently updated our design guidelines and construction standards, and they now require a few new things. So overheating sensitivity analysis. So that's looking at buildings being designed appropriately for future warming temperature conditions rather than looking at current temperature conditions. We're also looking at recommendations for passive cooling measures, so things like shading, building orientation, design features to reduce heating. So all the stuff, some of the things that that Dr. Schwandt referred to as well. BC Housing is beginning to implement some of those standards into our construction guidelines. And we're also looking at indoor air filtration adequate for wildfire smoke as we get into more of these wildfire seasons. Again, I'm going to throw another link in the chat for everybody here. If you want more information, this is called our, this is our Climate Readiness Housing Design Guide. So if you want more information on some of these design processes, you can take a look there. Next slide, Natika. And then this is just a reminder we wanted to put out that there was actually an update this year to BC's design building code. As of this year, effective March 2024, cooling spaces are now required in 1 living space per home, an area that does not exceed the 26 Celsius degree set point. Again, Dr. Schwandt identified. So that's actually a change to the building code that has gone into place this year. And my colleague Magda was really wanting to highlight just these changes often take quite a bit of time, but the government was able to pass this building code change quite quickly. And I think it's just noting the urgency and the awareness that the provincial and federal governments have to some of the extreme heat changes. So this is a big change this year. Again, in this photo too, we just wanted to highlight, this is a good example of a project that has external shading on its building. This is one of the newer developments in Vancouver Island, and you can see it's got these shades that kind of go over the windows to reduce that heating effect. Okay, I'm now going to pass it over to my partner, Pat, from Security and Emergency Services to speak to our emergency planning.
Thanks, Dexter. Good morning, everyone. Dexter, you can hear me okay?
Mm-hmm.
Excellent. All right. Thank you. Yeah, so just a couple of quick slides to help provide a bit more understanding on sort of the context of emergency management within the province. And of course, BC Housing is encouraging our partners to consider their own emergency response and hazard planning. So this is just a little bit of a contextual piece here. So it includes, like I said, a bit of an overview of emergency management here, very brief, but as well some terms that you might hear in terms of, terms that you might hear related to emergency planning, but as well as during a response. So just looking at planning and mitigation. And those are really both a shared responsibility at all levels of government. So from First Nation, provincial, local, and regional districts. But businesses and residents have a responsibility too. I just want to remind you that we're all in this together, so we all have a bit of a role. Planning are those steps that you can take to be better prepared for those impacts that can't really be eliminated. And mitigation are the efforts taken to eliminate or to at least minimize the impact of those hazards, such as the climate design guides and the building codes that Dexter just mentioned. Response in a disaster is typically led by the local authority, so the local community, the regional district, or First Nation, and is supported by the Ministry of Emergency Management and Climate Readiness. But they're not alone. Other ministries, such as the Housing Ministry, including BC Housing, and other ministries are involved, as well as other agencies, such as BC Wildfire Services. So the importance of planning is paramount to tie all of that together. So we do our best to mitigate and plan, but if a hazard does pose a significant threat to a community, your local authority might declare what is called a state of local emergency. So you might hear that more recently over the past few years. And a state of local emergency provides extraordinary powers during that emergency. For example, like issuing an evacuation alert or an evacuation order. And in real simple terms, an evacuation alert is letting you know that you should be prepared to leave your home due to the risk of the imminent hazard. An evacuation order is telling you that you do need to leave your home, that the area is being evacuated. With that will come instructions on where you should be going and whatnot. But just to really highlight the distinction between the alert, which is a preparatory stage, and the order, which is then the direction to leave. And you might also see that the province might declare a state of emergency. And again, this also just enables extraordinary powers that the province can bring into play. Typically, that's related to expenditures and the control and movement of important resources. And the next slide, please. Great. So just noted in the previous slide here, we all have that responsibility in emergency response management. So just to highlight a couple of things that you can do yourselves individually within your family unit, but also at work to be better prepared. And I believe that Lisa Benini is going to go into a little bit more detail on some of this. So this is maybe just a bit of a precursor to what you'll hear from Lisa. So first of all, know your risks, know your hazards. So identify those hazards that to help prioritize planning. And this is Emergency Preparedness Week, so it's a good time to really take a step to consider those plans and risks. Make a plan, so taking action to reduce the risk of impact. So as I mentioned, those mitigation efforts that you can do. There are some in the short term and some in the long term, but for example, just considering power loss and what you could do for having backup power for that, or removing debris and making landscaping decisions to reduce the impact from wildfire. And as a sort of way to think about it, and not to be too dark, but just consider being cut off from your everyday resources for a few days. So what would those important things need to be considered in your plan? Things like, do you have enough food and water and medication? And what would you do about communication if communication was down for a few days? And once we identify those risks and we do a little bit to mitigate them, we really can then jump into that planning piece. So give special attention to those who are most vulnerable. Begin to prioritize that perhaps within, again, your family units or the work that you do. They may need additional time to prepare to evacuate if that alert comes. That includes, of course, people with disabilities, the chronic health issues as impacted by the air quality and extreme heat, the young families as well. And let's not forget about our pets in that planning. You could also consider, how would you evacuate? Where would you go and how would you get there? Or if you're assisting others, what would that effort look like? And of course, it's important to test those plans. So exercise them, practice them a little bit. It is Emergency Preparedness Week. So today at 10:55, you might receive a test of the emergency alert system on your phone. It might also come through television and radio. So don't be too alarmed when you hear that at around 10:55 today, but that's part of the testing of the provincial system to notify people of imminent emergencies. And of course, with all of that planning done, now we have an opportunity here to really build a kit so we can put those pieces into play. So if you need to stay at home without services, having them centrally located so they're easy to find would be ideal. And preparing a grab and go kit. So if you do have to go, you have those important documents, medication, food and water and other things with you that you'll want to take with you. And I believe, Dexter, are you able to post a link to the provincial site where there's more information on all of this, especially being able to build a kit? So with that, I'll turn it back over to you, Dexter. Thanks.
Just multitasking and putting the link in the chat for everybody. Give me 1 second. So that's a link for the emergency preparedness kit. Good timing for today, for this week being the emergency preparedness week. Great, thanks, Pat. So next slide, we just want to go over quickly some of the information that is also available on our website. So BC Housing's been working on building out an extreme heat kind of information site for nonprofit partners and community partners. The site's just got a number of different resources that are available, also just information and updates for folks. So we like to push people to go visit the website to get information themselves, see what pieces might be beneficial to your organization. It's kind of got a wide berth of information, but every year we're updating it, trying to make sure the information is relevant and consistent and clear for folks. So I'm going to put a link to that in the chat as well. As I said, we got quite a few links today, but hopefully some of this information is helpful and available to folks here easily. So that's a link to the chat. Again, encourage you to take a look. We'll go to the next slide. And I think this one is a video. Yeah, so this is just a quick video. We just wanted to kind of highlight again, just the amount of resources that we have made available to nonprofits. Again, this is kind of this is focused on the lens of our nonprofits for resources available to your tenants. So we've got a number of things available to that resource page, but the video went quickly, but it's just, once you go onto that resource section, you can just see there's a bunch of different resources that are kind of clearly made available. If you go to the next slide, I'll show you. So we've got things like, we've got extreme heat posters. We've got leaflets used to give to tenants during wellness checks, or left when a tenant is not there during a wellness check. We also have posters that are available in 9 different languages to make sure that they're functional and useful for tenants that might not speak English. So again, BC Housing, we're just trying to support the nonprofits in ensuring that there's resources available if you don't have the capacity or the ability to create some of these resources. This might be a good place to even just start, look at what sort of information that we're trying to provide, and then it might be helpful for you to look at designing your own information if you want to take it even a little bit further past what we've put together. Go to the next slide. Yeah, this is another example. We've even got information for pets. So there's lots of good information on the slide or on the website. The next slide, please. Another thing that we wanted to bring forward is so in BC Housing we've also got a directly managed portfolio that's buildings that we manage ourselves. We found success in putting together cooling kits over the last year. These are kits that have a number of different items that can be given out to tenants so that they can cool themselves during these times of extreme heat. If they don't have easy access to a cooling room or space, this is something that can be made available at a fairly low cost. So just wanted to bring up the slide to recommend folks look into things like cooling kit. Again, more information is on that is available on our website as well. But we found these to be quite successful, and I think even Dr. Schwandt had a note on some of these items as well. So easy kind of support system tools that we can have for our vulnerable tenants, and that's something that we continue to develop and think about here in BC Housing. Next slide. So the next thing I wanted to cover is just how nonprofits can be prepared and how BC Housing can support you over this coming year. So 2021, that heat dome, it was a big kind of notice for everybody, but also for our supplies. I think that was a year where it was really challenging in some places to get supplies. So because of that, we've been really trying to encourage our nonprofit partners to be proactive and prepared every year to make sure that they have an inventory that they're actually managing. So an inventory for extreme heat supplies, that they know the limits of what they need. They have kind of a list of all the needed requirements, and making sure that you're checking those every year to make sure that you are topped up on your inventory. So identifying inventory items that need to be restocked, and BC Housing is open to providing funding support if it's not available to the nonprofit. So that's where we'd encourage you to check in with your NPPM or SHAW, your portfolio manager, if you need funding support for inventory that you don't currently have or that you've identified that you do need. Then proceeding to purchase extreme heat and wildfire supplies, do not wait. So that's kind of encouraging. Again, if we get into another one of these years where there's a little bit more challenge with procuring supplies, we want to make sure that nonprofits aren't waiting till the end so that they don't have to be concerned, and ensure that they do have what they need. And we're then monitoring health updates from Ministry of Health and our partner bulletin. So I'm going to throw a link to this to subscribe to our partner bulletin in the chat as well. That's just another, it just says subscribe there, but that'll take you over to our partner bulletin. That's a bulletin that we release. I think it might be monthly or bi-weekly, but that's kind of an updates that go out to our nonprofit partners with information that we kind of have internally. So just encourage folks to monitor and keep aware of the information that's coming out so that you know when you need to be prepared. And finally, when a heat alert is announced, if your region is facing supply shortages, we also have this email, extremeheat@bchousing.org. That's just an email. If you have supply needs if you're in a place where you really are in an emergency state, we do have a support system there. So that's extremeheat@bchousing.org. I will also put that in the chat. I feel like I'm overdoing the links, but we'll do it anyway. Okay, next slide. So what supplies can BC Housing support with? So again, we really want to emphasize we are here to support reasonable requests for nonprofit partners. We encourage nonprofits to use the funding that you have available. Your NPPMs or portfolio managers will be partners that you can talk to if you do need additional funding, but we're also looking at reasonable requests. So we're not, sometimes we get requests for things like air conditioners for every unit of a building. It's really not the case that we can support those kind of requests, but what we can support, or at least have conversations and trying to support you with, is things like cooling areas or common area spaces to ensure that there is a safe place for tenants to go if you don't have that available. Definitely check in with your portfolio managers. We want to ensure that buildings do have a safe space for people to go. We also can provide things like air purifiers to the same extent. We probably won't provide those to every unit, but in common areas to make sure that there is a place where people can go. And for outreach and areas that are a little bit more challenging, like our SROs, we've been leaning into things like tents and misting stations to make sure that people can get out of their buildings and units when they really need to. Water and cooling kit supplies, as we noted above, those are things that we would consider funding, and even N95 masks as we get into these these smoke, the wildfire smoke. We want to make sure that there is resources available for that as well. If you have more questions or need more information on that, again, you can either email that extreme heat link or contact your MPPM or Shaw, who will be able to give you more information. And finally, we just wanted to encourage everybody to share your success. We're always looking for new creative solutions to share with the sector. It's a very active sector with a lot of parties trying and testing different things. So we're really encouraging you to share your organizational solutions, not just with us, but your colleagues as well in different organizations. We're all in it together. This is it's a ever developing challenge every year, and you know, encouraging trying to find new solutions as different technologies or different approaches might be set up. If you have ideas or thoughts, we're welcome to collect that information from you as well at extremeheat@bchousing.org. And that's it for me. Thank you so much. Thanks, everybody.
Thank you so much for sharing that, Dexter. Next we have Lisa Benini.
Good morning. Thank you very much for allowing me to speak today. So this presentation is going to focus on the outcomes of a one-year risk reduction project that actually was funded by Canadian Red Cross. The funding was provided to BC Society of Transition Housing, and it was actually focused on the women's transition housing across the province. And so I'm a business continuity professional, and I worked with Louise, who is the program coordinator, on this together. So I want to walk you through some of the things that we have prepared to help the women's shelters, but will also actually probably apply to a lot of other types of nonprofits. So again, we're hoping these tools will actually help any organization be better prepared. Next slide, please. So we developed this sort of planning process, and we called it emergency management because we knew you had to manage an actual emergency as well as continue to provide the services coming out of these women's transition housing. And I'm actually very pleased that we were able to get this process going, and we have seen that even from last year that some of the benefits from this planning is already starting to work, that some of the women's shelters are actually being able to anticipate the fact that they have to deal with extreme heat, the fires that have happened across the province, and that now they've got some strategies in place because of the planning they've started to do. One of the other things that actually came out of this planning process is that we created sort of an H-stage process to actually help them develop the plan, and this is now being put onto an online platform. We had 5 pilots participate in this. And so I want to just recognize their time because it was invaluable to get their input on how to use the tools and make them work for the women's transition homes. So we had Princeton involved, and Davis, Transition Society from Chilliwack, the YMCA from Kamloops, Safe Society from Salmon Arm, Elizabeth Fry Society from Prince George, and BCSTH themselves participated in the project. Next slide, please. So we know that when these events occur, and we've seen over the last few years, we've actually seen that, you know, the anti-violence sector is always slightly higherly impacted from these events, especially with women with children who are seeking, you know, safe places to go. So as a last resort. So we know how important these places are for them. And yet we do see the increase in violence on women and children and youth during and even after events. So, you know, the need for making sure that these places stay open and that these women and children can go to even becomes more important. And the fact that they're fleeing during even a disaster is even harder on them. Next slide, please. So just to give you a high level overview, and I know I don't have too much time today and I could go on for a long time, but these are sort of the templates that we have developed. So there's an overarching plan that is definitely a template where they plug and play. We've provided them a number of appendices, which again are all documents that are template format that they just have to fill in. And then they have the annex, what we call the annex side, which is really dealing with the emergency preparedness and the response procedures to all these different types of risk events. We've also designed some sample exercise plans, and we have a risk assessment process as part of this toolkit. Next slide, please. I just sort of wanted to showcase you the actual online platform. So what we did is we took the tools that were all in Word and Excel, and we were able to develop this online platform, which kind of steps them through each step and associated supporting document. And we were very honored to have members of the pilot groups actually put a video in of how they addressed each of the different stages. And this tool is available. It's free enrollment. Again, just remember that it has been developed for the women's transition housing, but I don't think there would be too much problem with any organization, any nonprofit where they're looking at the housing element, being able to use these tools. Next slide, please. So I just wanted to walk very quickly through the stage process. So we actually heard from Pat already. He said a few key steps in there that actually, again, I based a lot of it on, you know, what the province has put out there. So when you are starting to look at this, you have to build a team. You need a team, and that could be your management with a couple of program specialists, where you are going to be responsible for developing the plan and ultimately responding to the event. So that's the first thing, is to consider this as, don't take this on by yourself, to really look at your organization and start with a key number of people who are going to be responsible for helping build this plan. The next thing you need to do is look at assessing your risks. As Pat just said, you know, what are we at risk of? And there's a number of things out there. So we've got templates in there to walk through that. Once you know what your risks are, and obviously extreme heat and the air quality is one of those things that we've seen, wildfires and other things, let alone, God forbid, if we ever have earthquakes and stuff like that. But the next thing would be, once you know what your risks are, look at stage 3. How am I going to protect my people and my property? You know, how do I get out there and communicate with my staff and the people that I'm supporting, the residents and my clients, key stakeholders, vendors, and ensuring that everyone is very well aware of what's going on. And then even again, thinking about the steps you can take to protect your property and the facilities, and keeping those doors open around even insurance coverage, to, you know, what can I do to prevent and what can I do to mitigate these types of threats and hazards to my organization. The next stage that they would go through is then looking at what are their operational and resource requirements to keep the doors open. So this is kind of the bulk of the work, where they would actually have to walk through and start thinking about, you know, what is it is essential to keep my organization continuing during and after an event. Then we have a stage on developing a financial contingency strategy, because we all know that sometimes it takes time to get funding in a disaster, but how are you going to sustain that? How are you going to pay your employers or your staff? How are you going to pay your debt? And really trying to get through and recover from an event. So we've put a step in for that. Stage 6 really takes all the information that they've now gathered through these templates, and they plug and play into a template that they call their emergency management and service continuity plan. And then, of course, like any good plan, we need to make sure that staff are trained on how to use the plan, and we use that through exercising. So we've developed a sample exercise plan that includes 4 different scenarios. You know, a power outage, telecommunication, a fire in your building, and then a mass evacuation of the community, which would then impact your organization having to evacuate. And then, like any good plan, we need to maintain it. So the last stage is making sure that the organization starts to establish mechanisms that they can continuously keep the plans up to date, exercise, and then really look at the risks that are now coming forward throughout the climate change and other types of things, even including cyber, because that's another thing that we are highly seeing a lot of lately. Next slide, please. I just wanted to showcase some of the samples from the actual toolkit. So we've provided them with a very simplistic risk assessment, but again, thinking that, you know, these organizations don't have a lot of time. So like, quickly understand what are the threats and hazards that are out there that could have an impact on my people, on my facility, on my operations, and the others I depend on. And then getting them to kind of come out with this total risk score do some rationale around it, and then get them to focus on what do I need to prepare for. So next slide, please. So I just wanted to highlight that we've actually developed 15 different emergency preparedness and response procedures. And these procedures really do help them now with focusing on those different risks. And as you can see, we've got extreme heat. We've got one for shelter in place if they have to stay put, and obviously air quality and a lot of others. Next slide, please. The other big piece that I just talked about is the resource requirements worksheet, which really gets them to walk through what are their critical services, who are the staff that support those services, what is the inventory, computer inventory. So again, understanding what they've got to work with, how reliant are they on systems and what do they have for workarounds, coming out with a telecommunication strategy, understanding vital records, both electronic and paper, and then also looking at their assets and resources. Another big piece is the food and water that we just talked about. Again, really important for extreme heat. And then the relocation strategy. If they do have to evacuate these safe houses or these transition homes, where are they going? Can they go locally? Can they have to go to another community? Because they can't go to reception centers like a lot of the other folks. So it's really important for them to have these strategies in place. Next slide. And then, of course, they develop the plan on how they're going to, what they're going to do before, during, and after. And like I said, a lot of this stuff is already templated and they're just filling in the blanks. Next slide. I'm not going to read this, but this was some of the comments that we got from our pilot groups that supported this project. Again, it's about the process and getting people together to walk through the actual toolkits and be better prepared. And last slide. Just wanted to highlight that we are continuing with this work, and we're also involved with the JIBC and BC Housing on identifying best practices for working with local governments. Because we do realize that nonprofits need to be heard and involved with the localized level with planning, and of course being that advocate for this. And I've left our contact information if anybody wants to follow up with us after today. And I'm going to provide this presentation, which has a lot of notes and other information in it for you. Thank you.
Amazing. Thank you again so much, Lisa, for sharing your insights with us today. We'll move on over to our next piece of the webinar today, and I'll invite Shahid to present.
Thank you so much. Thanks everyone for sticking with us. I will briefly provide an overview of the report that the Aboriginal Housing Management Association recently published, titled "The Stories of Extreme Heat Among Urban Indigenous Households in British Columbia." And I know that everybody has already, next slide, please. Everybody has already provided different land acknowledgements, and I'm very thankful for that. But I just want to very briefly acknowledge that I work, live, and play on the unceded and traditional territories of the Musqueam, Squamish, Tsleil-Waututh, and Coquitlam nations. And at Alma, we honor elders past, present, and future from all nations and traditional territories. And as many again have already acknowledged, the land and waters colonially named British Columbia are home to many, many different First Nations and over 290,000 Indigenous people. Next slide, please. Thank you. So just briefly, my name is Shahid. I'm the Energy Projects Coordinator working with Alma, and I have been working in the Indigenous and nonprofit sector for a while now. So I'm very grateful to be here and share this, the results of this report. And next slide, please. And AMA, as I keep saying, stands for the Aboriginal Housing Management Association. We are a members-based nonprofit, and our members are mainly Indigenous housing and service providers across British Columbia. Next slide, please. Our mission is to lead and advance the housing rights for all Indigenous people living across British Columbia, and we provide an array of different services to all these housing providers that can be in many, many different regions across BC. And next slide, please. So today, we will very briefly go through the research journey that led us to this report, some of the stories that we heard, and very briefly, again, the pathways that came out of the stories that were shared during these conversations. And at the end, as folks mentioned with the panelists, I'm hoping to answer any questions that you may have. Next slide, please. So as again, many have already alluded to, we know that climate change is causing intense and much longer climate-related emergencies and heat waves across British Columbia and around the world, right? So we experienced a terrible one in the summer of 2021. And of course, equity-deserving communities and Indigenous population are at a much higher risk due to many systemic barriers, which many times are the legacies of colonialism, which has led to poor quality housing, chronic health conditions, and lack of resources and capacity. So we basically embarked on this journey to do this research so that we can better understand the impacts of climate change on our housing providers and see how we can better support them right in the future, as obviously, unfortunately, more climate-related emergencies are going to be happening. Next slide, please. So we were able to engage with 16 team members of our Indigenous housing providers across BC, and this report is basically a reflection of the stories and the input and comments that they provided during interviews that we performed. So most of the interviews, all of them were virtual, and a lot of different feedback was provided to us. And to bridge, I guess, the realm of theory with these lived experiences, we also performed some research on academic and gray literature. Next slide, please. So this is just one example of the many impactful stories that were shared with us. So as we can see in this quote, the heat dome had devastating impacts on many Indigenous population across BC. Next slide, please. So yes, as I mentioned, a lot of messages were shared. Some highlights are that housing providers told us that they are faced with interconnected barriers that they're trying to protect their tenants from extreme heat, and all of these interconnected barriers are making them more vulnerable when it comes to extreme heat events. So they reported that they had to deal with compounding effects of wildfires, smoke, and extreme heat simultaneously at the same time. So they told us that they really would support more help when it comes to more holistic and wraparound systems that provide them with cooling equipment, but at the same time other supports like HEPA filters, right? So that they can provide more healthier indoor environments for their tenants. In addition to that, they told us that capacity and resources are a big barrier for them. So they would support more funding and resources so that they can hire folks, right? So that they can plan better for future climate emergencies. And the key message, honestly, that really stood out for me was the fact that despite all these barriers, they had very deep and long-lasting relationships with their tenants. So despite all of that, they were able to protect the most vulnerable in their community, which was honestly very inspiring to hear. Next slide, please. So all these climate emergency planning really needs to be responsive and targeted to local conditions, because as we all know, rural and urban Indigenous communities experience extreme heat very differently. So we need to think about what each region actually needs and what are the vulnerabilities, right? And unfortunately, because of systemic underfunding of Indigenous housing, a lot of the population is living in low quality and poorly built and inefficient homes, right? That a lot of times are not built for the local climate. So tenants, are a lot of times thermally uncomfortable. They have to deal with poor insulation, mold, and high heating and cooling costs. So these are becoming urgent issues that really need to be addressed. So our housing providers told us that they would need more resources and funding so that they can build more energy efficient homes, because that's a very important step for them to protect households, right? Against extreme heat and climate emergencies. And of course, balancing this transition to low emissions with the fact that they also need to ensure that tenants have access to reliable, affordable, and accessible heating and cooling systems. So addressing all those challenges, especially when it comes to funding and capacity, is a big piece for our housing providers. And next slide, please. Again, in this quote, as we can see, and many sitting in this call may know, energy poverty is a big and significant concern for tenants. So while having access to cooling systems and air conditioners is providing much needed relief during the extreme heat in the summer months, they reported that they also have to deal with operational costs, like increased operational costs. So they called for more financial incentives and help for their tenants to actually deal with the I guess, inevitable increased costs that come with running cooling systems. Next slide, please. So just very briefly, highlighting again some of the important messages that came out of these conversations, all indicated that, you know, for them, housing is always the foundation for mental health, physical health, and social and economic well-being. So for them, it's very important to protect the existing housing stock. And remembering that, you know, one size, again, does not fit all. So if we are designing programs and policies and emergency planning, all of that needs to basically be done looking at the vulnerabilities and strengths of different regions, right? That each of these housing providers are basically protecting and trying to serve. So we really need to adopt a targeted approach when it comes to emergency planning. And all these heat response plans basically, again, need to be more holistic because housing providers are dealing with multiple challenges at the same time. So it's not just extreme heat, it's also wildfire, it's smoke, it's health conditions, and many, many other challenges. And most importantly, I think remembering that with that, we really need to move towards decolonization because all these challenges that I mentioned are, of course, rooted in colonial systems. And decision makers, that they make decisions and design programs, they really need to make meaningful steps towards addressing these root causes. Try to nurture existing Indigenous institutions and programs, right? And provide, again, policies and pathways that directly support Indigenous-led climate mitigation and adaptation strategies. And of course, most importantly, uplifting and centering Indigenous rights and Indigenous ways of being. So with that, I'm going to close this presentation. I know it was very short. Next slide, please. I know I'm going to be answering questions later, but I really encourage everyone to please go and read the report because this was just a very quick overview. And again, thank you for listening, and I'm looking forward to answering questions. Thanks.
Thank you again, Shahid. And I'm sure folks are already thinking of their questions. We will definitely get to them and we'll go through them via the chat. So if you'd like to pop them in there ahead of time as well, please feel free. And finally, we'll move over to our last segment of today's webinar. Kelly, whenever you're ready.
Hi, I'm here to represent Turning Point's Collaborative Society. Today, I'm going to be talking a little bit about preparing and responding to extreme heat, wildfire, smoke, and if you're unfortunate enough, wildfire evacuations. Next slide, please. My name is Kelly Fair. I serve as the Executive Director of Operations for the Society. We serve the communities of Enderby, Vernon, Kelowna, West Kelowna, and Summerland. I'm coming to you today from the ancestral, traditional, and unceded territory of the Okanagan Silks and Splatson people. Next slide, please. So the two key areas that I'm going to be talking about today are procedures around evacuating and extreme weather response from our experience, and a little bit around fire evacuation planning. So last year, we evacuated 3 of our sites, 2 out of West Kelowna and 1 out of Kelowna. We don't have a lot of time, or I don't have a lot of time today, so I won't have too much time to speak to this specific topic, so I'm going to cover it a little bit right now. The other presenters did a great job, and so much of what they said is really relevant to our experience over the last 2 years, but specifically the last year. So we're very thankful that we did our fire evacuation planning in advance of having to actually evacuate 3 sites. And this list right here are the key things. If there's nothing else you take away from what I'm saying today is please reflect on these key things when you do your planning. Is who do you include in your planning? Your management team, your staff, and the people that you serve. You will learn a lot from the people that you serve. Thinking about where is your alternate command center. So in the event your administration office has to move, where are you going to set up? And what do you have to take with you? What do you have to salvage? I think as not-for-profits, we're still tend to be fairly paper heavy at times. So ensuring that you have a list and everybody knows what they need to get. Emergency response centers. I think it was Lisa spoke a little bit around emergency response centers aren't always trauma informed when specifically their volunteers when they're working with marginalized populations. So this is something we learned from our experience. And so in revamping our plan for this year, we have dedicated staff that will be responding to the response center set up by the municipalities or regional districts to ensure that the support is there for marginalized, specifically homeless individuals or those with chronic substance use issues. Notifications. we made sure that our notifications were prepared in advance. So that includes notifications to people in our affordable housing, in our shelters, in our addictions recovery programs, because they're all catered slightly differently, because the organization responds to the different program types differently. Staff coordination. This is really vital, ensuring that you know in advance of what staff are actually going to be able to assist in an alternate work site if you do have to move a shelter, as an example, to another community. Who's going to be able to follow you there? Who's going to be able to transport the clients with you, because they're going to want to come back and potentially evacuate their homes or retrieve their vehicles. So important things to consider beforehand. Site salvaging and enclosure. What do you need to take from your work site, whether it be a shelter or supportive housing environment, that has to be salvaged? That might be the client's medications, overdose prevention supplies, things like that. One thing that we learned is somebody left a rear door open of one of our sites, and we were called back by the police to help somebody out who was sleeping in the site afterwards, which potentially put a number of people, put myself at risk going back there. So something to make sure that everybody knows what they're responsible to do. Client transportation. So ensuring you know which buses are available, or how you're, whether it's the municipality, the school districts, private bus companies, how are you going to transport your population, and how many round trips is it going to take to move everybody to that different location? Understanding that not everyone you serve may be getting on that bus. And so how do you do your best to account for everybody? And then temporary accommodations. Not everyone you phone is going to welcome you coming to their community or coming to their facility. This was a very lengthy process for us to find someone that would take us in. Luckily, we have built some very strong relationships with other not-for-profit partners, and because we're an organization that operates across a number of municipalities, we're able to move some people to one of our other sites, or a few of our other sites in Vernon, and other not-for-profit partners took some people in Penticton. And this couldn't have been done through our existing relationship with BC Housing. And then lastly, for this area, is resuming regular operations. So ensuring you're going in there and conditioning the air, removing the smoke in advance. You may have to do a building condition assessment before removing them. But these are key areas around planning in advance. Next slide, please. So when talking about activating an extreme weather response, in Vernon, a heat wave, or sure, I should say the Okanagan, a heat wave is when temperatures are 35 Celsius or higher for 2 consecutive days, and overnight if it remains higher than 18 Celsius. A heat emergency is when those same temperatures last longer than 2 days and there are concerns for health and safety of vulnerable populations. In this situation, other levels of government, whether it be the province of BC, Interior Health, or your municipality, may initiate additional warnings, protocols, and resources. Next slide, please. So when we talk about communication procedures between providers, so in Vernon, we have partner organizations that use what we call the Cool Team email distribution list to communicate. The Cool Team is a pre-established, essentially an outreach team that consists of Bylaw, the RCMP, Interior Health, and a number of service providers that have been operating since 2008 with the goal of supporting people that are living in encampments. We meet monthly. And during these type of heat incidents, we update each other on program changes. We ensure that those changes are emailed in real time so that they can get out to the organization's frontline staff and clients that need them. We have a survival guide and other related brochures that are updated and provided at the library, emergency shelters, and to our outreach teams. Next slide, please. So in talking about those that are unsheltered, those that are living outside, again, we have brochures and different survival tips. Our outreach team goes out and provides those posters to the individuals and does wellness checks. And because it's a collaborative team, we're able to identify where most of the camps are to try to reach everyone that we can. Next slide, please. So we have a few different resources that will extend their hours as staffing capacity permits when there's extreme smoke conditions or heat. So our emergency shelters, our local mission, our outreach clinic, mental health and substance use offices, community safety office operated by the municipality and different service providers. Our library will do that. And then our local Anglican church does provide lunch on Saturdays, and they'll try to extend their hours at that time too. So I can't say enough how key partnerships and collaboration between service providers is in order to serve the population. Next slide, please. So drinking water, absolutely vital. So we have 24/7 access in Vernon for water fountains. We have 3. Our library has drinking fountains. We have a few different not-for-profits, including Interior Health, Mental Health, that have water bottle filling stations. And then our shelters and other service providers continue to ensure that they're able to hand out bottles of water. And then our outreach team goes and delivers bottles of water regularly to the encampments. Next slide, please. So we talked a little bit about posters. Our cool team partners will provide access to additional bottled water as needed, as I said. We'll reach out to BC Housing and municipalities in these conditions to ensure that we're able to access funding. And again, BC Housing, as they had talked about, comes to the table time after time with air conditioning support, fan support. They've actually, quite honestly, exceeded my expectations in their timeliness and response when we've needed them to be able to respond to these type of situations. Next slide, please. So this slide and the next slide are just samples of posters or brochures that we ensure get into the hands of those that need them. So a list of where people can access water. Next slide. And where people can find safe spaces with air conditioning. And that we find to be a real challenge, especially those in our affordable housing sites. If we can't get air conditioning units into everyone, as Dexter had talked about, it's not always possible to order 400 air conditioners. Bit of a shortage in the summertime, but ensuring that people do know where they can go. Next slide, please. So when it comes to dealing with media inquiries, we learned this the hard way as a collective of organizations. It isn't always the best process to have one spokesperson, because there can be different mandates within organizations, and staffing capacities can change depending on what's going on. So it's important that, from our experience, that each organization does their own media communications. Next slide, please. So what if the wildfire smoke escalates and the fire is at your door? So does your organization have a plan in place? Will you prepare to transition your clients to an alternate location? And do your staff know how to respond? Will they participate in an evacuation of the site and transportation to the alternate site? We talked a little bit about that at the beginning. Next slide, please. Do you know what your staff will prioritize when salvaging an at-risk site? That was something we really learned during our last evacuation. Is we thought we had this nailed down, but we really learned there was over communication. So ensuring that you have established lines of communication, which person or which position at which site is going to receive the communication, which staff is going to be in charge of salvaging client belongings and medications, etc. Next slide, please. Where will your staff stay? This was a big one for us. Trying to find motels. We ended up actually using Airbnbs in Penticton when we moved a number of staff over there to operate. So ensuring that you've vetted those different accommodations in advance. Next slide, please. And what can you learn from our experience? So we were well prepared. We had already trained our staff in evacuation. It would not have gone nearly as smooth if we weren't prepared. We had regular planning meetings, minimum of once a day, leading up to the evacuation, during it, and as restoration work was completed at the sites. BC Housing and service providers from neighboring communities were there to support us. Can't extend enough gratitude. And just knowing nothing Not everything is going to go as planned. So be prepared to pivot. And that's why it's so essential that as a leadership team, you're meeting on a regular basis. Next slide, please. So we talked a little bit about this, about who to include as you're doing your planning, your communications plan, your finance department, human resources, operations. Ensure you include your joint occupational health and safety committee. It's really important to get frontline staff feedback as well. And then your residents and your clients. Next slide, please. So I understand that was a lot of information to get through in 5 to 7 minutes if I was able to keep to that time frame. There's my contact information. If you do have any questions, please don't hesitate to reach out, and happy to assist where we can. Thank you for your time. Happy to be here.
Thank you so much, Kelly. I do see here there are a few additional resources that BC Housing has provided. I'll make sure that these are also provided to you via email after the session ends. With that, I'd like to thank all of our presenters for their time, their wisdom, and their expertise. Given that we are quite short on time, I'd love to begin the Q&A process here. And if you folks have any questions, please feel free to send them to us in the chat. And I would like to ask if you'd like to include which one of the speakers you'd like to answer. That would be fantastic as well. So we do have a question here from Chloe. Have shelter drop-in spaces received BCH funding to expand outreach and drop-in center hours or staffing during extreme heat events to support unhoused individuals in community? I believe this may be a question well suited for Dexter.
Yeah, I can jump in there. So we haven't increased staffing funding at this time. I've had a few questions about that. So it's something that we're putting forward and we'll bring to our executive team and try to promote. Obviously it's quite a bit of funding to get staffing changes done, and it can be quite a long process. And because of the temporary nature of things like extreme heat season, it hasn't been something that we've directly started, but it's definitely something that we're hearing this year. So I'll continue to advocate for that, but internally we're still at the process of expanding staffing.
Thanks, Dexter. Chloe, I hope that answers your question. If you do have a follow-up, please feel free to raise your hand and unmute yourself and speak directly if that is something you're comfortable with. And also to other folks, if you prefer to directly speak, that works as well. You don't have to send in messages in the chat, whatever best fits your learning needs. Bit of a quiet room today, hey? Oh, yeah. I do see.
Hi. Can you hear me?
Hi. Yes, we can hear you.
Perfect. So I was just wanting to see how we would go about getting the evacuation plan for our office. Like, is there a link that's in the chat, or is there somewhere else that I have to go?
And is this with reference to the last piece of the webinar we saw with Kelly? Is that the evacuation plan you're looking for?
Yes, please.
Yeah, Julia, we put ours together as an organization. We used Vision Group Consulting just to assist us in that process. I can certainly drop their information in the chat. I'll also put my email address in the chat.
Okay.
So you can certainly fire me off an email, and I'd be happy to follow up with you too.
Perfect. Thank you so much.
I'll just add to Julia that so each organization is kind of responsible for developing their own plan, but what my colleague Pat mentioned, we shared a link, and I've tagged you on that too, the Prepared BC Emergency Guides and Resources that should have some information that might be helpful for you as well.
Perfect. Thank you so much.
Thank you, Julia. Next question is from Chloe. Can Dr. Schwandt share the two temperature thresholds for heat risk again? Sorry, the slide went a little too fast.
Absolutely glad to do that, and no apology necessary, except for me for moving through it fairly quickly. And I'll reshare the screen here, just as I just speak through it. Generally speaking, some of the research that's been done, and this is looking at older adults or people who might have challenges to cooling, physiological challenges, has found that there's an increasing risk that seems to begin around 26 degrees. So especially for people who are more susceptible to the impacts of high heat, risk can really begin there. They found that at 31 degrees, there's a very significant risk. So there's kind of an inflection point where that risk begins to rise. Not much difference between 23 and 25, but does begin to rise in the high 20s, around 26. So definitely cause for escalating actions to cool a space or even move out of that space. And certainly 31 degrees we would describe as, for people who are vulnerable to high heat, as a dangerous space at that point. So those are some of the thresholds that we've been trying to share. This is new research, from University of Ottawa as a leader in this topic that informs us. And so BC CDC and your regional health authorities are really working with these thresholds for a lot of the advice that we give right now, and also some of our policy advocacy around cooling, around policies to support tenants in different contexts too. So thanks for the chance to clarify and share again those two thresholds.
And we have another question for you, Dr. Schwandt. Could you please comment on DIY air purifiers?
Yeah, glad to. I think this is an area where we've seen more and more research over recent years, and also that's been synthesized and developed into some guidance, again, from our BC Centre for Disease Control, finding that these can actually be quite effective. There's more and more good directions out there online, in the world that we live in right now. There's that opportunity for different makers to iterate and improve on designs. So BC CDC has actually tested and posted some of the guidelines to DIY air filters. So these can be created with box fans and air filters in a variety of different configurations. Without trying to describe the best model, there's a few different good types, including Corsi Rosenthal boxes, as they're called, available. And there's been workshops put on by the National Collaborating Centre on Environmental Health, the City of Vancouver, and others involved in past years, and that might be a possibility this year to build these. We find that as well as being effective and a lot cheaper than portable air filters that are available commercially, building these and working together with neighbors to develop them is a great opportunity to discuss air quality and raise awareness too. So that's we feel pretty positive about those, and it's been I think reassuring to see that the science has really developed and found that these, again, when well constructed with the right materials, can be quite effective.
Thank you so much, Dr. Schwandt. And I do see Sarah mentioning in the chat that was a timely emergency alert test. Yes, I agree. I may or may not have panicked as I saw my phone while I was trying to mediate. Fantastic. Any more questions from our lovely group here? Please, again, you can feel free to use the hand raising option on your Zoom screen. Lisa, yes.
Yeah, I just, in the chat box, I just put in there the link to the online platform. And like I said, it's free enrollment. Just know that it was developed for the women's transition houses. But I think there's a lot of maybe templates that might be useful to anyone else on the call here. So, feel free to check that out.
Thank you so much. And I think folks would benefit from if we on our end could compile all of these fantastic resources. We'll list them out and we'll categorize them based on the speaker in the organization that shared them, and we'll definitely be sending them out. Looking for any other questions? All right. I think that might be all for now. Again, thank you so much on behalf of BC and PJ to all of our lovely participants. Thank you for coming, taking your time and engaging with us, and to all our speakers. We look forward to seeing you again in the future, and please stay safe, stay healthy, and I wish you all a wonderful day ahead. Take care, everyone. Bye.